free nerve endings. Free nerve endings are important for especially temperature and pain modulation. Let's start off with pain. Pain can be enacted by a number of substances and molecules released in the skin. Mast cells are one of our most important, and mast cells release histamine and prostaglandins. These two things will cause a pain response. How do they do it? These substances can bind to a free nerve ending, and that free nerve ending senses histamine or prostaglandins as painful. Besides mast cells, you can traumatize certain areas of skin. What do I mean by traumatize it? Agitate it, you can pinch it, you can rub it too much, and that traumatized layers of skin will also produce prostaglandins that can cause pain. Other ways that stressed skin release substances are things like potassium, bradykinin, even hydrogen ions. All of those substances can stimulate the free nerve endings to cause a painful response. Even sensory afferents can release substance P, which gives the perception of pain in that area. And finally, sometimes even cholinergic agonists. These are things that you normally use in the skin to do things like cause sweat glands to sweat. If they're overactive or there's too much acetylcholine in the area, that too can stimulate a free nerve ending pain receptor. So all of these molecules are felt or perceived by the body as painful when they're in the skin and touching or in close proximity to a free nerve ending. Now, cutaneous nociceptors or pain fibers can act in a few ways. One is there is a response in which they are polymodal. This means they may respond to one or more stimuli. And why this is important is because you can have mechanical stimuli that cause nociceptive responses, chemical reasons to cause nociceptor responses, and thermal receptors that can cause nociceptor responses. So let me go through a couple of examples with you. So if you have a mechanical issue, that might be something like if you took the skin and it was cut, or maybe a chemical component is you're releasing local chemicals, or maybe you spilled something like acid on your skin. However, sometimes you can have both mechanical and thermal components at the same time, and that would be a polymodal type of a response. So let's go through this temperature aspect of causing pain. There are nociceptors for cold and nociceptors for heat. Now these are separate nociceptors than the ones that cause sensations of cold or sensations of warm. So these are a separate population of free nerve endings. The ones that respond to cold utilize these trip channels. And these trip channels are ones for heat using TRP1, which is also known as a capsaicin-sensitive channel, because if capsaicin is around, it will bind to it and you'll get that feeling of noxious heat. What is capsaicin? It is the same thing that's in chili oil or in hot peppers. It feels like it burns when it's on the tongue. It can even feel like it burns when it gets on some places in the skin as well. A feeling of cold is a menthol feeling, and that is that feeling of evaporation or that cool. That is not painful yet. To get to the painful cold response, you use a TRP1A channel. These TRP1A channels are associated with things like mustard or horseradish. That is the sensation one gets when, whoa, it's so cold, but it hurts at the same time. So you can see that TRPV1 and TRPA1 are the two things that mediate this noxious cold and noxious heat. Itch. Itch, oddly, we do not know a lot about. It seems like we should understand how itch works, and we understand a lot about it, but really we can only classify it in broad terms. Itch is from free nerve endings. These are the same free nerve endings that might cause pain. They might cause a change in temperature. So it's hard to know when a lot of receptors can do similar things. What we know is there are histamine-mediated itch and non-histamine itch. These are the two classifications that we derive, and we know this because if you infuse histamine in the skin, you get this feeling to want to itch. And this is oftentimes what someone who is even doing things like an allergy test is looking for. They're looking for a little bit of raise in the skin, a little bit of edema, and the feeling of wanting to itch a certain spot. There is non-histamine mediated, but it doesn't have the same classification because we don't understand it as well, and we don't have good medications to fight it. Because we, for example, have antihistamines as anti-itch creams that we can apply, and that takes away the histamine-mediated itch, but doesn't touch the non-histamine-related itch. We'll have to keep investigating that one.